My name is Momo Amos, a youth advocate in an organization called Vijana Africa, Vijana African Voices Initiative, based in Kiambu.
My name is Susan Mokuhe. I'm a youth and mental health advocate and a YouTuber discussing issues to do with mental health, HIV awareness, and so much more.
My name is Evans Masharia, founder of Vijana African Voices, a community-based organization within Kiambu County. Yeah, we focus on youth empowerment and especially promoting positive masculinity and focusing on the SDG 3 and 5, which is good health and well-being, and also creating gender equality among our generation.
My name is Albina Demoregi Mumu. I'm a member of Mental Voices Africa. We do advocacy through film making, and I'm here to represent the group.
I am excited to be here today because this is one of the relevant topics that we need to be discussing. We need to talk about mental health every day because it's a major issue in our society today.
My name is Emmanuel Misiati, and for today I was the facilitator. Health capacity building by BNBR for particularly 3 reasons: networking, self-care and life balance in mental health advocacy, and then lastly we did problem solving. So we did a small solution clinic for financial problems that we face in our organizations when we are advocating for mental health. So that was the program.
I came here expecting that the information that will be given to us, or the information that we'll obtain from this forum, will be for the programs that we do, or directly related to the beneficiaries that we offer the services to. But shock was on me when I found that we were the beneficiaries this time. Most of the times we are the service providers, but this time we were the beneficiaries, service providers in quotes. This time we are the beneficiaries.
Our day began with networking. We got ourselves to do an activity where we enacted or put into practice several networking skills, such as how to introduce yourself, how to introduce your organization, how to progress the conversation from small talk to establishing common ground, to all the way till the end where you can establish connections.
The funny thing about interacting with youth, you always learn a unique thing that you would carry home, and getting to interact with the new faces, it brings you to a point whereby we youth have the necessary skills and the solutions to change and transform our community, because at the end of the day, we are the next generation. We know what is affecting us on an individual level, affecting us on a society level, and also affecting us in our families and at home. Yeah, so the network, the partnership we are forming will be very key in terms of how are we be able to come together and use the energy we bring together as a synergy to be able to bring the big bang that we want there, and disrupt the necessary processes that affect matters of mental health. Yeah.
We did self-care, which was also a lot of fun. Under self-care, we asked ourselves, what are the current habits that we have that make part of our self-care routine balance, if we could call it. Something that we all agreed or had a consensus on is that many of us young leaders advocating for mental health are doing so much but taking little or no care of themselves, either because of being overwhelmed, sometimes because they do not know how, but majorly because they're just exerting themselves too much.
I realized that most of the time, as mental health professionals, we forget about ourselves, but I was equipped with strategies that will enable me from today henceforth to take care of myself as I take care of other people.
We finished with a solution clinic where we looked at a 5-step process to problem solving and did a practical session for group work where groups looked at the problems that they have within the organizations and went through the same process to come up with solutions all the way to actions.
I would say right now we don't really have that systematic structure to solve problems in the organization, which is something to take home, to go and actually sit down and cultivate probably a policy or a structure on problem solving, whether big or small, because problems are bound to come in and without, and we need to solve them meticulously. Yeah.
We have been solving problems but not keen on how we solve the problems. So I look forward to solving problems in a systematic way. Energized, motivated, educated, and better than I care.
I would say bumped up. I'm so much energized, satisfied, because the forum exceeded the expectation that I had.
I'm really excited. I feel energized. I feel like I have refilled my cup. It's like I came in when my cup was half and now it's full, it's overflowing.
I feel a bit, I need time to reflect in terms of how have I been taking care of myself as an individual. Has it been holistic? Yeah. Maybe I'm focusing on only one angle, which is my physical aspect of it, but I forget about my social, relationship, on how do I engage with people. So it's a time for me also to reflect on an individual level and also sit back and see what have I been doing that I can do differently from the training we've had, and also how can I bring more impact to my community. So thank you for the platform, and thank you for Basic Needs, Basic Rights, for including us in this platform. It was nice for me. Yeah.
Feedback was really good.
Today's forum was really enlightening and insightful. I got to learn a lot of things, and also I came to realize that the challenges I'm facing, I'm not facing alone. Other people in the same field are also facing the same challenges that I am, and getting to be together and discuss about solutions to these challenges was really enlightening.
I would give thanks to these Basic Needs, Basic Rights organizers, because as I've said earlier, mental health issues, specifically mental health programs dedicated to the service providers or the CSOs or the people that offer those information or services. The programs are not targeted to us. They are targeted to the beneficiaries that we tend to focus on, or the community at large. So I think that's a gap that the organization has filled, which is a good thing. It will be very satisfactory for that to happen more, for this to happen more and more and more to organizations within and without. Yes.
One of the comments given by I think her name is Susan, one of the participants, was that today was particularly enjoyable because it was focused on the change makers or on the actors. And I think that's very profound, because in another capacity, I'm also a volunteer, and I will totally agree with her that most of what we get is what we need to know or what we need to do to make change wherever we are. But we rarely take time to focus on ourselves and what we need to build ourselves better. So I think my final thought is just, let us do this again. We need to do more forums on building capacity for young leaders and ensuring that not only are they capable, but they are also comfortable and safe. So today was amazing. I hope we do this again.